Mm, mm, yeah, yeah. Mm. Everywhere people need care, fighting back.
When you opened your brochures and saw the Ghana Medical Trust Fund on the agenda of a national mining dialogue, I know the question that ran through your mind. What does a medical trust fund have to do with gold, bauxite, or oil? I know, it is a fair question. And my answer to you today is simple. The Ghana Medical Trust Fund has everything to do with mining. You do not extract value from the soil. You extract value through people. And when the health of a nation collapses, the foundation of every industry, including yours, will collapse with it. Let me take you out of this air-conditioned ballroom for a moment. Imagine a man who has worked honorably for 30 years. He built a modest home, paid his taxes, educated his children, and planned for a peaceful retirement. Then, a diagnosis confirmed that he has prostate cancer. Instantly, his life dissolves. His family sells off land. They exhaust every savings. They borrow from friends. And when the money runs out, they sit in a hospital corridor, throwing their hands in the air, asking, what else can we do? This is the devastating reality of non-communicable diseases in Ghana today. But the tragedy does not end with a diagnosis. The real tragedy begins when the doctor looks at the family and says, we don't have the equipment to save him here. You must take him to Accra. They travel for hours, across regions, from rural mining districts to Accra. By the time they arrive, 3 things have happened. The family is financially ruined. The patient is significantly weaker. The cost of treatment has doubled. Now, some in this room might think, this is tragic, but if my family or I ever face a medical crisis, we can afford private care or flight abroad. Ladies and gentlemen, let me challenge that assumption. What happens when a critical heart attack strikes you at 2 a.m.? Can you wait for a flight to London or Johannesburg? Can you charter a jet whilst a cardiac wall is collapsing? Can you move a dying relative across international borders while life is slipping away second by second? At 2 a.m., money cannot, and I mean it, money cannot buy you your life. In a medical emergency, your wealth does not save you. The infrastructure nearest to you does. This is not just a social welfare issue. It is a human reality for every single person in this room. When President John Dramani Mahama established the Ghana Medical Trust Fund just about a year ago, and I was handed the responsibility to administer the fund, we conducted a comprehensive nationwide needs assessment across our teaching hospitals, regional hospitals, and referral hospitals. What we found should awaken every leader in this room. Across our public tertiary healthcare facilities, we found only 2 functional MRI machines. We found only 2 public radiotherapy machines for cancer treatment across the country. And in the entire northern sector of Ghana, there were only 2 practicing cardiologists without the appropriate equipment to serve millions of citizens. When you look at these numbers, you understand why our people suffer. You understand why care is delayed and why lives are lost. One location was dictating survival in Ghana, and that is Accra. At the Ghana Medical Trust Fund, we refuse to accept the status quo. We have therefore built an intervention framework rested on 4 strategic pillars. 1. Patient support. We started with a pilot program supporting 50 critically ill patients, funding heart surgeries, brain surgeries, and chemotherapy. Those weren't just 50 pilot cases. They were 50 lives restored. But financial aid alone isn't enough if the machines don't exist. 2. Infrastructure and retooling. We are retooling hospitals based on hard data, not guesswork. President Mahama was at the Kolebu Teaching Hospital a few weeks ago to commission into use a new and modernized cardiac catheterization laboratory. We are currently constructing cath labs at the Konfanochi Teaching Hospital and the Tamale Teaching Hospital. We have plans for Ho Teaching Hospital and the Ifiankwanta Hospital. 3. Human capital. A machine without a doctor is useless. We have partnered with the Ghana College of Physicians and Surgeons and sister institutions with an ambitious target to train and deploy at least 10 chronic disease specialists in every region of Ghana. Research and innovation is the fourth, but not the least. Building data systems to ensure we tackle tomorrow's health crisis with evidence, not assumptions. In September, the trust fund will be a year old. We have made progress, but let me be transparent with you this afternoon. Government cannot do this alone. The trust fund cannot do this alone. Which brings us to the core theme of this dialogue, rethinking the social license to operate. For decades, the mining sector has defined its social license through traditional CSR, building a small school, digging a borehole, or grading a road. I challenge you today to elevate that standard. A true social license cannot simply mean the community tolerates our presence. It must mean because this company operated here, our people live longer, healthier lives. Your host communities are not coordinates on concession map. They are homes. They are human beings. When you, miners, your local contractors, and their families face chronic illness, where do they go? They depend on the very regional and district hospitals that lack equipment and specialists. Imagine the power of a mining company saying to its host region, we didn't just extract gold from your soil, we built the regional cancer center that saved your mother. We installed the cath lab that saved your chief. This is not CSR. This is an unshakable generational social license. To the CEOs, directors, board chairs here today, we are offering you an investable, transparent, data-backed partnership. Do not build healthcare solutions in isolation. Partner with the Ghana Medical Trust Fund. Invest in us. Invite us in. Let us map the healthcare facilities serving your host communities. Co-invest with precision. Use our nationwide needs assessment to buy the exact medical equipment your regional hospitals lack. Sponsor specialists. Fund the specialist training of doctors and nurses who will stay and serve in your operational zones. Let us build an infrastructure that endures long after your mining leases have expired. Ladies and gentlemen, years from now, history will not measure your leadership by the exact ounce of gold extracted. Market analysts will forget your quarterly profit margins. The public will not remember the contracts you signed. But I guarantee you this: a family will remember the hospital that saved their father. A child will remember that their mother survived cancer because the equipment was nearby and close to their community. And a community will defend an enterprise that protected its rights to live. The gold beneath our soil is valuable, but Ghana's greatest resource has never been underground. Ghana's greatest resource is the Ghanaian. Let us rethink the social license. Let us build a legacy of health, dignity, and survival. Because when life is on the line, none of us can stand alone. Let us prove to every Ghanaian battling disease that they are not forgotten and that indeed help is here and truly Mahama cares. Thank you very much.